starting a conversation with our own Dr. Geetendra Sharma. Basically, Dr. Geetendra Sharma as being a Vice President Foxy, but पांच चीजें बहुत important है, which everyone should know about the Geetendra Sharma, a very good leader. And he is able to put the advocacy of all the subjects which he is doing, knowledge and expertise in the subject of medical legal, which has been, he's helping all over India, right from top to bottom, the juniors, the seniors, everyone. And the collaborative approach of Dr. Geetendra Sharma towards the problem solving and the ability to work efficiently for the healthcare professionals. So today's topic is very simple. We are going to discuss few things regarding the Consumer Protection Act. And I think he's the right person. That's why we have chosen. So thanks, Team Triple B, for having this. Please stop sharing the Geetendra Sharma's CV, and only interview should be there. So that please, I'm extremely sorry. Only myself and Dr. Sharma should be there so that we can produce this thing. So welcome, sir. As all of us know that you are being with us, please switch off the videos of everyone so that only myself and sir will be visible. Thank you so much. Please switch off the videos. Yeah. Sirji, welcome once again. And the topic is Consumer Protection Act, which I think it's a very good topic and everybody wants to know many more things about you. And at least what I know about the Consumer Protection Act is very simple. That's what are the disclosures of information, what is the care, and many more things. I don't want to go into it, but I like to ask a few questions. As before we start, you can have some opening note regarding the CPA, and then we can do the few question and answer, which is very simple to our OBGY, which will they have the take work message and they will not be fear about this act. So over to you. Welcome, sir.
Madam, thank you for giving me this opportunity to meet all three Bs of Indore. And I feel really fortunate to be the part of this webinar today. Today we have given the topic to the webinar is a CPA, a nightmare. Yeah. So really it is a nightmare nowadays for a doctor. See, we all know that in 1995, one decision came that was VP Shanta versus Union of India. And after that decision, doctors were included as service provider under a Consumer Protection Act.
Yes.
And why it has become nightmare? Because the cases against doctors are increasing day by day. So every year 104% rise is there. And gynecologists rank first. And that is the worrisome point for us. Maybe because we are treating two patients at a time, mother and fetus. And we are dealing with physiological condition, that is delivery, in which no complication can be accepted by anybody. So that may be the reason of increasing cases against gynecologists. See, the amount of compensation is also increasing day by day. In 1999, the maximum amount of compensation awarded was 19 lakhs rupees, which rose to 2 crore rupees in case of Prashant Dhananka in 2010. And in 2013, it rose to 11.5 crore rupees in the case of Amri Hospital in Calcutta.
Yes.
So, dear friends, CPA do not leave you even after your death. So, even the doctor is dead, even then the case will continue in the consumer commissions. And multiple prosecutions are allowed. So somebody who can be prosecute you in CPA can also prosecute under different commission, Women Right Commission, Human Right Commission. The case can be filed under criminal law at CMO's office, at Prime Minister's office, at State Medical Council or Medical Council of India. So there are multiple fora simultaneously available for patient to file a case. And why it is a nightmare? Because that reason is that no cap of compensation is there.
Correct.
The quantum of punishment is not capped or not decided. Correct. There is no clarity regarding interest on the award. So somebody may give 6% interest, somebody may give 9%, somebody may give 12% interest on the award. So correct. There is no uniformity at all in the judgments given by different commissions. And surprisingly, nowadays, there are many cases where the gratuitous compensation, that is goodwill gesture compensation, is also awarded to the patients, where there is no negligence on the part of doctor.
Correct.
Now,
Sir, basically, I just want to make it a
yes,
simple questionnaire manner, so you can answer and we can give a correct take-work message to everyone.
yes,
So it's a nightmare. We all talk about the Consumer Protection Act, and everybody, like people like us, are very worried that this case should not go to CPA or this like this and many more things. So do you like to talk about what about the jurisdiction of the Consumer Protection Act? And as I've gone through and I'm reading a little bit about it, and I found it out, there is a Consumer Protection Act of 2019 is different from the previous version. So is it good for us or it's bad for us?
so definitely, madam, as we know that the old Consumer Protection Act 1986 is now repealed. So that means now that act is the past. Now new act has come, that is Consumer Protection Act 2019. And in Consumer Protection Act 2019, there are so many harsh provisions added. See, regarding pecuniary jurisdiction, we all know that previously the pecuniary jurisdiction under 1986 guideline was different. But now in 2019, the provision which was first put, we must understand one thing, that previously the words used for pecuniary jurisdiction was that value of goods or services or amount of compensation awarded. Now the word amount of compensation demanded is removed. So now the pecuniary jurisdiction can only be decided upon the value of goods and services. So that means whatever patient pays to the hospital, according to that pecuniary jurisdiction will be decided. So if any patient pays below 50 lakhs rupees, the case will be filed in district commission. In between 50 lakhs to 2 crore, then case will go to state commission, and about 2 crores, the case will directly go to state commission. So definitely most of the patients, 99.9% patients are not giving more than 50 lakhs rupees as a bill to the hospital. So that means all cases against doctors will be filed now in district commission only.
So you mean that because of this new Consumer Protection Act and the jurisdiction, the value and the amount has been limited to fixed amount, and that's the problem. So you have already talked about the territorial limitations of CPA. That's the another thing which you talked about, and how it impact to the consumers.
In territorial jurisdiction, madam, previously it was said that patient can file a case against doctor at a place of business or place of residence or place of happening. Okay, so that means where hospital lies. But now in this new act, it has been added that patient can file a suit against doctor where patient resides. So suppose you are in Indore and some patient from Kerala comes to you.
Yes.
And if that patient is not satisfied with your services, that patient can file suit in Kerala also. And it is very difficult for doctor to defend in Kerala in district commission, because in district commission usually the cases are been discussed in local language. So how do you represent your case in Kerala?
So it was bad.
Yes.
It was really bad. Means for the doctor having a case also, and to going all around up to Kerala, for example, crossing the territory. Am I right?
Yes.
And then there the Consumer Product Act also address about the unfair practices and the penalties. Would you like to talk something what actually it imposed on our businesses and found how to engage in such practices?
Madam, unfair trade practice is not been exactly defined under this act, but it has covered multiple things. We know recently the case decided by National Commission, and in that case, not taking proper consent is considered in the case of RG Stone Hospital versus Vinod Khanna. In that case, it was regarded as unfair trade practice. Not to issue bill to the patient is also considered as unfair trade practice. Refusal to accept the goods which you have sold. So suppose you have sold some medicine from your hospital, and if you refuse to take it back, if some defect is there, then also it is considered unfair trade practice. You breach the confidentiality of the patient. That is also considered as unfair trade practice. So although there is no tight compartment to define unfair trade practice, but there are multiple things which have been included in unfair trade practice: misleading advertisement, as well as excessive pricing. is also considered as unfair trade practice.
Okay,
So
okay.
these are few examples I can quote for unfair trade practice.
So basically, you mean that when the doctors should be very much careful while doing many more things to not get themselves entangled into the Consumer Protection Act.
Yes.
And what basically, what are some punishments that can be imposed and found out in a Consumer Protection Act? How are these determined? Isko ye punishment hai, wo punishment hai, wo punishment. How it has to be determined?
So basically, under Consumer Protection Act, the punishment is the compensation.
Yes.
That is a normal thing. Okay. Now, how compensation is decided? We all know that previously there was a method known as multiplier method.
Okay.
According to that, they will consider a person to live up to 72 years, and they will count the compensation according to the average age of a person, that how many years he should have lived and how many compensation to be awarded according to that. But in multiple cases nowadays, even the multiplier method is not been considered. And it was said that if we will consider multiplier method in a patient who is not earning at all.
Yes.
So suppose a lady of 30 years who is a housewife who is not earning at all. So we count according to multiplier method, the compensation will come near about 2 lakhs to 3 lakhs rupees only.
Okay.
One of the judgment, it is said by the National Commission that nowadays doctors are earning a lot.
Correct.
And only 2 lakhs, 3 lakhs compensation will not satisfy the patient or patient relative. So that's why there is a reason not to follow multiplier method, and compensation should be awarded usually on the discretions of court nowadays.
Okay, so it's more on. Do you think it's more on the person who appeals, or it's more to closer to help doctors also? Just to
usually,
simple,
nowadays, madam, the compensation amount is going very high.
Correct.
So even for missing one anomaly on sonography recently in one case, 1.25 crore rupees compensation is granted. So
Correct.
I don't know that in future what is going to happen.
Correct. So it's providing the appeal as well as what processes must be followed to initiate the appeal. For example, for the patient, for us also, how to initiate the appeal.
So, madam, as well as we know that always appeal is always available in any cases under any law. Correct. So, Consumer Protection Act, it is mentioned that if you lose your case in district commission, both parties can file an appeal to state commission, and that is to be done within 45 days. And if you lose your case in state commission, you can file an appeal in national commission within 30 days. Now, clutch particularly is there in 2019 Act, and it is mentioned that in 2019 Act that only one appeal will be allowed. So if you lose your case in district commission, you can go to state commission. But if you lose your case in state commission, you will not be allowed to go to second appeal in national commission. And if you want to go to national commission, it should be only on the basis of question of law. So if there is no question of law involved, only depending on the question of fact, you will not be allowed to go into second appeal.
Okay.
So that is the problem with this particular.
2019. In a new act. And how does the Consumer Protection Act addresses the issues related to online transaction, commerce, and so many things are there? Because what protections are provided to the consumers? Basically, all the Consumer Protection Act questions are more towards the person who are appealing, and how we should save ourselves as a doctors are very important. So is it important for that nowadays? All the online transactions are there, so many things, and how they are
commerce is also been involved under Consumer Protection Act, madam.
Okay, so it's not like that, like a previous one, or the transactions are like over there. Then what type of complaints can be filled? See, because what patient is doing, we should also know that what complaint they will do, and they will fill under the Consumer Protection Act, and how these complaints can be possessed, and how we can resolve this type of complaints.
So, madam, actually the basic behind filing complaint is negligence. So see, consumer courts deal with the basically whenever patient enters in your hospital, it is an implied contract between patient and doctor.
Yeah.
And according to that contract, the doctor has to provide due care, and that care is of certain standard. So
Correct.
if doctor do not provide proper care of proper standard, and if due to that breach of the duty, if some damages occur to the patient, that damages are usually awarded as a compensation by the courts.
Correct.
Okay, so they deal with the negligence as well as the deficiency of services. So if your services are deficient, also they will take into consideration that also.
Actually, basically, as being a doctors, we have seen the very consideration regarding the CPA and what impact we have. We have to do many disclosure of the information we have to do with them, no? So this is okay, including the information we have to give, like what are the options, what are the risks, what is the cost, what is the potential conflicts of interest. So many things are over there while disclosure all these things. Sometimes it is needed, sometimes it is not needed to tell everything, I tell you. So where we are saved ourselves when the Consumer Protection Act is there as a doctor.
So basically, madam, whenever we treat any patient, then it is our duty to inform a few things. First, the purpose of treatment, then what procedure you will do, what will be the success and failure rate, what are the alternatives available, what are the risks of that procedure, and what are the risks if a patient will not undertake that procedure. So these are a minimum things which we should explain to the patient. Simultaneously, in medical financial counseling, we have to explain that what will be the charges, what will be your package, what it includes, what it does not include, what are other things which may be required during treatment. So we have to explain it. Nowadays, information can only save you. And when you do medical counseling or financial counseling, you have to take signature of the patient on that.
Yeah.
That will definitely save you.
Correct. So, Consumer Protection Act, which we are talking about, is there any difference between the Consumer Protection Act 2019, which we are talking, and the consumer protection laws, which all around the countries are there?
So now 2019 has become law.
Yeah.
So,
yes.
So we have to follow this 2019 Act only.
Correct. So this is the big point over there, but the interest of consumers also, interest of doctors also, with both the parties. What should be your take-home message, especially for the doctors, because this is the thing that why should worry, when to worry, when not to worry, how to proceed, and how can we save ourselves by not getting entangled into the Consumer Protection Act. That's a take-home message which everybody will like to listen from.
So, madam, as we know that since we are included in Consumer Protection Act in 1995, after that, the situation has become different. Now, after that, the situation is, it is said that he who pays for the piper decides that what tune they want to play.
Oh, amazing.
Okay. So, that is the situation today. And the interrelationship means relationship in between doctor and patient has become now of service provider and consumer. So internal faith and internal understanding is now nowhere. Every doctor is doing safe practice nowadays. Every doctor is prescribing maximum investigation to safeguard themselves from this type of cases. So basically, condition is definitely worsening nowadays. One more thing that considering this aspect, there was a discussion when this act was enacted in 2019. Before that, we know in 1986 act, the word medical field was not there. Okay. Now it was added in 2018 draft bill. Later on, after discussion in parliament, the healthcare word was removed again. And in that discussion, the then minister, Mr. Paswan, he was discussing in Rajya Sabha and Lok Sabha, and manuscripts of Rajya Sabha and Lok Sabha both are available, where most of the parliamentarian said that doctors or healthcare should not be put under CPA. And if we put healthcare under CPA, then we are not going to allow this bill pass in the parliament. So he gave assurance. And after that assurance, he removed the word healthcare from the draft bill. And then this bill got passed. So everybody, every doctor was rejoicing like anything that nowadays, now on, healthcare will not be under the jurisdiction of CPA. But surprisingly, after that enactment of the act, the different commissions continued filing case against doctor. And one PIL was filed by MLAG in Maharashtra, and then later on in Supreme Court in appeal, and we lost both the cases, and ultimately it was decided that healthcare is still under CPA, and that is very much unfortunate for our fraternity member.
Correct. So thank you so much, sir. This is a very really good, and the what take-home message which I felt about, it's advisable for all the doctors fraternity to, they basically, number one, they should familiarize with the consumer protection laws. Am I right, sir? And then the regulations applicable to them in the jurisdictions and the compliance, so that the minimize potential legal risk. But the best part is you should have a qualified legal professional expert like you. Whenever
to avoid consumer complaint, you should remember all C's. Your conduct should be proper. You should maintain confidentiality of the patient. You should not be careless in your practice. Then
courageous.
Proper consent. Communication should be done properly. You have to maintain confidentiality of the patient. So if you remember all these C's, then definitely you will be able to avoid this consumer C.
Correct. And the most important is to recommend to consult the qualified legal professional like you. It's within your jurisdiction also and your own fraternity also. So you will get a specific advice regarding the Consumer Protection Act, and we should be able to implication for the doctors. So thank you so much, Geetendra sir, for being with us. You are a friend of ours for a long time, and I am sure that a small dialogue between you and me has worked.